Hello, I'm Maima Kaiser from Dr. Bill Advanced Neuroscience class. We're currently exploring phantoms in the brain by Dr. V.S. Ramachandran. I'm from group 5 and 6, and I will be discussing hemi-spatial neglect. One of the reasons why I chose this topic is because I'm interested in treatment available for patients with hemi-spatial neglect, and I'm also interested in recovery mechanism. What is hemi-spatial neglect? It is the inability of a person to process and perceive stimuli on one side of the body. Research have shown 33% of patients with hemi-spatial neglect on the left-hand side compared to 50% of patients with hemi-spatial neglect on the right-hand side. One of the reasons why this is occurring is due to the idea that right hemisphere contain neural network capable of attending and presenting both sides of space, whereas the left hemisphere is concerned mainly with contralateral right side. Common causes of hemi-spatial neglect. One of the most common causes of hemi-spatial neglect is due to stroke. Another cause is due to head injuries. Again, I'm just giving a broad idea on what is it, what causes it. Now focusing mostly on the type of hemi-spatial neglect. There are different types of hemi-spatial neglect. You have visual neglect, you have auditory neglect, you have motor neglect, and you have representational neglect. And also you have somatosensory neglect. I'll discuss this more in detail during class period. However, I just want to give a brief understanding of what are the type of neglects. Spatial cognition. One of the information I found from different articles that I researched was spatial cognition relating to 3D, thinking in 3D. There are different types of spatial cognition: object-centered neglect, egocentric, as well as allocentric. Object-centric neglect, this is where a patient copy everything exactly on the paper except they neglect the lesion area, which is the left side of that brain. Egocentric, this is where patient are focusing directly on an object. They tend to focus only from the center of the hemisphere, from everything else on the side that isn't damaged, and does not see anything else on the damaged area. Allocentric, this is where patient focus on object to object. Common disorders. There are several common disorders, namely hemianopia. This is where a loss of vision is either the right or left side of both eyes. There are treatment available for disorders such as hemianopia. You have optic visual span expander, visual restorative therapy. Noting that these disorder are treated, do not treat hemianopia. However, they helps patient perceive the world around them. Another disorder that is also known as the hemiplegia disorder. This is result from the loss of motor function on one side of the body. This is commonly caused, again, another cause is stroke. Treatment are available. This is where patients and work with therapy, or therapy work with patient and helping them regain their mobility, helping them regain their ability to eat, to talk, to be understood, and etc. There are also other treatment that is available for patients with hemi-spatial neglect. Innovative treatment which uses electric current to stimulate the brain, visual exploration, involvement of such strategy and speed using paper, pencil, and wild field projection devices, neck muscle vibration. Vibration of left dorsal neck muscles lead to a shift of objective space toward the contralateral hemisphere. And you also have spatial perception, feedback related training of visual spatial deficit in neglect. You also have optic kinetics, which is the use of coherent visual background motion to shift attention to contralateral hemisphere. Again, recovery mechanisms are habit invented for patients with hemi-spatial neglect. However, noting that these recovery mechanisms do take long time, even as long as 12 years. But most patients have shown recovery within the first 6 months of treatment, where other patients have shown longer recovery up to 12 years. Thank you for watching my video. I hope you did understood everything I said. If not, I will be discussing this more in detail in class. Thank you again. Bye.